My name is Joe O'Donoghue. I'm a plastic surgeon and I work in Newcastle. And I have my NHS practice in the Newcastle upon Tyne NHS Trust. And my main practice there is mainly around breast reconstruction and particularly microvascular breast reconstruction. And then my independent practice or my private practice is carried out at two hospitals around Newcastle. And I do pretty much all aspects of cosmetic surgery in that side of things. Well, I'm from Ireland, as you probably can guess from my accent. I'm from Ireland originally. So I did my medical training in Galway, and then I started my plastic surgery training in Ireland. But I finished my plastic surgery training in the UK, and then I did a fellowship in cosmetic surgery in London at the Wellington Hospital, and then I also did a fellowship, a specialist fellowship for a year, almost a year, at the Marie Curie Institute in Paris, and that was in breast surgery and breast reconstruction and oncoplastic breast surgery and so on, before I took up my first consultant job in the UK, which was in St George's Hospital in London. And but I've been in Newcastle now since 2002. Well, that was kind of a serendipitous moment, really, which kind of happened when I was a medical student. And at my university in Galway in the west of Ireland, we didn't have a plastic surgeon when I was going through my early training years. But they did appoint a plastic surgeon just at the year I qualified for medical school. And he gave an introductory lecture when he arrived to show what plastic surgeons did, and he just completely knocked me out. So I approached him afterwards and said, I would like to be your first house officer. So I was, and his registrar and so on. And he was my mentor for many years, and that's where it came from, really. That's very difficult to say, what I love most about plastic surgery, because the technical side of it I really love, which is the surgery. But I really enjoy my patients. I really enjoy knowing about my patients, knowing their stories, what it is that brought them to seek help from a plastic surgeon, what they want to change about themselves, and then seeing the very often dramatic effects that it has on their whole quality of life and their well-being. And that's the thing I really enjoy. And it's not just about getting technically good results, which is clearly what we're always after, but it's about making people feel better about themselves. And that's a very, very important thing, both in reconstructive surgery as well as in cosmetic surgery. A typical day for me is not really very typical. It tends to be very varied. So I may be doing operation sessions in the morning, clinics in the afternoon, or vice versa. I do on-call arrangements for trauma for the National Health Service every so often, both during the weekend and weekends. A lot of my private practice work has to fit around my NHS commitments because of contractual arrangements. So my cosmetic surgery practice tends to happen outside of my NHS hours. So I run my clinics in the evening and I do my operating time at protected schedule times that are agreed. But a lot of it is done at weekends as well. So.